Hi everyone. This video is dealing with the sensitive topic of suicide. Suicide is death caused by self-inflicted injury with the intent to end one's life. Suicide is the major risk for patients with severe depression. Nearly 15 to 20% of patients with affective disorders, these are illnesses that affect the way you think and feel, eventually commit suicide. In the United States, an estimated 6 to 12% of the population will experience depression at some time. The annual suicide rate is 12.93 per 100,000 individuals. Suicide is the 10th leading cause, in fact, of mortality. Internationally, in 2005, 1.4% of all deaths worldwide were attributed to suicide. However, we must also iterate that strong cultural prejudice and stigma resulting from depression or suicide attempts in many countries predicts that these figures may be gross underestimates. The risk of suicide is increased by concurrent illness, alcohol, drug abuse, and access to lethal means. Hopelessness, pessimism, isolation, and impulsivity also contribute. The risk is reduced by help-seeking behavior, access to psychiatric treatment, and availability of family and other social supports. Suicidal behavior is the most lethal combination of depression. A depressed person may think of suicide to end the pain of depression or to convey the pain to others. Many patients would not contemplate suicidal activity, but will welcome death by a sudden heart attack or an accident. Some would make impulsive suicidal gestures to convey their despair to others without a definite plan to die. Suicidal thoughts are complex. Please do not dismiss them as people who are just seeking attention. It may indeed be that they want attention, but this is their way of calling out for help. It is the act of giving them attention, helping them get support that may save their life. In fact, most people who attempt suicide do not want to die. They just feel like they cannot continue living the life they have. They want help, but are so overwhelmed by feelings of hopelessness and the pain that engulfs them, they do not see a way out. Reaching out can save a life. In fact, this reminds me of an interesting story of a famous psychiatrist by the name of Viktor Frankl, who wrote a book, Man's Search for Meaning. Unfortunately, Viktor Frankl had spent years in Auschwitz, the concentration camp, incarcerated because he was Jewish. Upon him being released, as we may say, at the end of the war, he became famous for the book he wrote, Man's Search for Meaning, and became worldwide well known. There's an interesting story of him chatting to a person who had become suicidal. Viktor Frankl spoke to the woman for more than 4 hours. In fact, that had kept her alive. Later on, when she was asked, what did she remember about the conversation as to what Viktor Frankl had said to her for 4 hours? She said she couldn't remember a single sentence. But what had changed her was the fact that Viktor Frankl was prepared to listen. The fact that he was prepared to give his time for 4 hours made the major difference. So in fact, what we can do as friends and family is to listen to those who are depressed and then offer them the appropriate treatment in terms of seeking a mental health professional who will help with the diagnosis and treatment. Sometimes patients may not even recognize the severe depression themselves. They may blame a physical illness for their bodily symptoms. They may consider the entire situation arising out of the sad mood as totally hopeless. There is no hope. There's no way forward. They will in fact refuse treatment. They'll hide their illness, fearing rejection because of social stigma. As much as they contemplate suicide, they'll tell you that the next moment they cannot seek help because they need to deal with work and other commitments. The risk of suicide has to be appreciated, in fact, from the patient's behavior and body language. Remarks about death or suicide should never be ignored. It is imperative to approach the person with the love, care, and respect so they feel supported and cared for. When someone genuinely asks whether the person is feeling suicidal, it gives them permission to tell you how they feel. By talking about their feelings, they have a different perspective and a better chance of discovering options that are not regarding suicide. By far, the strongest risk factor for suicide is in fact, sadly, a previous suicide attempt. It is if a family member or a friend appears to be extremely distressed, don't leave the person alone. Stay if you can with the person and try to keep them as calm as possible. Get immediate help by reaching out to your local emergency number, be it 911 or whatever it is in your country. Take the person to an emergency room. If you, in fact, are having suicidal thoughts, know that you are not alone. There's always hope. Have faith, have courage, have a belief. Believe that there's more. Believe there's always love available. Mental health conditions are health conditions. They must be and can be addressed. Mental health care is being given more attention now by the world over. Depression, we know, is recognized as the second most prevalent illness. So always, if you're feeling in trouble, feeling alone, feeling suicidal, speak to someone you feel you can trust. Reach out to a mental health practitioner, be it a nurse, social worker, general practitioner, psychologist, or psychiatrist. They can be accessed at your local government or private medical clinics. If you still can't access these resources, nowadays there are helplines and non-profit health organizations that you can find on the internet. Help is available, and usually access to someone to talk to is available 24/7 in this day and age. You can call your healthcare provider or go to the nearest emergency rooms. Generally, what you'll find is these calls are 100% confidential and are run by people who are happy to talk to you and help you deal with your feelings. Nowadays, religious organizations are more accepting of mental health illness and also can assist you in putting you in touch with the appropriate services. Use the internet to educate yourself as to the resources available and how to discreetly access these organizations, because many of us don't want others to know. We want to do this confidentially. Let's help ourselves by understanding ourselves. There are many resources available to understand, to introspect, to reflect on who you are and allowing yourself to get to a better place. So seek the help you need. Empower yourself, not just to move out of your negative mood state, but also to bring the best person you can bring to the fore. So take care. You can be all you want to be and more. So we will continue to talk about mental health issues as we go forth. Reach out for help. We take the first on the road to the treatment in terms of medication and talk therapy. Open up discussion about this so that you can be the best you can be. So until next time, look after yourself, be strong, have faith, have conviction, have belief. As much as your logical, rational mind suggests there's no way forward, step beyond the logic and rationality. Step into a world of conviction. Believe in a world beyond your current negative mood state, into a positive state, and that will set you free of the negative feelings. So until next time, take care. Bye.